find out what's going on with you, and then afterwards I'm gonna go over it with my supervising physician. Is that okay with you?
Yes.
Okay, it's nice to meet you.
Nice to meet you.
So, what brings you in today?
I have a cough.
Oh, I'm sorry to hear about that. Can you tell me a little more about this cough, like when it started?
It started about 5 days ago.
Okay. And, can you tell me, is it a wet cough or a dry cough?
It's wet.
Okay, have you been coughing up anything?
Yeah, kind of green, thick stuff.
Okay, right. What about any blood? Have you seen that in? Okay,
No blood.
right, good. And have you noticed anything else going on with this cough? Like any fevers? I noticed you had a fever today.
Yes, fevers and some chills last night.
Okay. Did you take your temperature at home?
Yes.
Can you tell me what it was?
It was 101.5 last night.
Okay. And what about, have you been feeling any chest pain or painful when you're breathing?
No chest pain.
Okay. And what about any shortness of breath?
Yes.
Okay. Okay. Do you smoke, Miss DeWitt?
I do.
Okay. That's right. How much do you smoke, and for how long has it been?
Half a pack a day about for the past 10 years.
Okay. So, do you normally have any cough or shortness of breath? Or
No. Well, I do have some shortness of breath, but I feel like it's gotten worse over the past couple of days.
okay. Okay. And this cough is also a new cough. It's not how you're usually feeling.
Yeah, it's new. The cough
Okay.
is new.
All right. And do you know what started this cough? Do you have any idea? Have you been around anyone sick?
Actually, the people at work are also sick too with the same thing.
Okay. Okay. And where do you work?
I'm a cashier. I'm at a grocery store.
Okay. Okay, good. And have you been traveling anywhere recently?
No.
Okay. Do you have any pets at home, or have you been around any animals?
No.
Okay. What about, I'm not sure if you've had this or not, but have you ever been tested for tuberculosis? Just asking. Like, they do a test sometimes when you work?
Yes, I was tested for work.
Okay. Do you know what the result was?
Negative.
Okay. Good. Do you know how long ago that was?
About a year ago.
Okay. And I just want to ask you a few more questions about your history, okay?
Okay.
All right. Do you have any other medical conditions? Like maybe high blood pressure?
Yes, high blood pressure
Okay.
and diabetes.
Okay. And do you take any medications for those?
I take lisinopril and metformin.
Okay. How long have you been taking those medications?
A long time. A
Okay.
long time.
All right. And do you have any other medical conditions, or have you had, just in the past, have you ever had any kind of cancer, organ transplants, anything else that you can think of that might affect your immune system?
No organ transplant or cancer or anything like that.
All right. HIV?
No.
Okay. All right, good. And do you drink alcohol?
Occasionally.
Okay. And what about any drug use?
No
Okay.
drug use.
And the lisinopril and metformin, are those your only medications?
Yes, those are my only ones.
Okay, good. Have you been taking anything for this cough or fever?
No.
Okay, good. And have you been feeling anything else going on? Any sore throat? I'm just gonna list a few other symptoms that you might have been feeling. Sore throat,
No.
congestion, runny
No.
nose.
No.
Okay, body aches.
No.
Okay, what about ear pain or discharge?
No ear pain or discharge.
Okay, and no changes in your vision?
No.
Okay, all right, good. And any headaches?
No.
Okay. All right. And what about any weight loss in the recent past?
No weight loss.
Okay. All right, good. Well, that's all of the questions I have for you about your history. So, okay, so I'm just gonna go over everything that you've told me to make sure I have all this right.
Okay.
So you said this cough started about 5 days ago and it's been getting worse. You've had some fever and chills with it as well. And you are producing some green sputum.
Mm-hmm.
Okay. And you said no blood that you're coughing up.
No.
Okay, and no chest pain.
Right.
You do have some shortness of breath, which is worse than usual.
Mm-hmm.
Okay. And you've been smoking for the last 10 years, but this is a worse cough than that.
Mm-hmm.
Okay. And you said your only medical history that you know of is diabetes and high blood pressure.
Right.
And you take lisinopril and metformin for those.
Correct.
You've been on that for a while.
Mm-hmm.
And no other medications.
None.
Okay. All right. Well then, if you don't mind, now I'm gonna just do a little exam on you and check everything out, see how it looks, and then we can go from there.
Okay.
Okay? So if you don't mind, I'm gonna have you take your shirt off for me.
Okay.
So I can listen to you. Actually, I'm gonna start off, I'm just gonna feel your face here and tell me if it hurts anywhere when I'm pushing on you.
Mm-hmm.
Okay. And I'm gonna take a look at your ears. Feel them. And do you have any pain when I'm pulling on your ear right there?
No.
Okay, I'm gonna look inside your ear. Just checking your tympanic membrane to make sure there's no redness or bulging or fluid.
Okay.
And any pain over here?
No.
Okay, good. And I'm gonna look inside of your nose. If you tilt your head up for me, okay? Just checking to make sure there's no fogginess, redness, or congestion. Then I'm gonna feel your lymph nodes here and make sure there's no swelling. Okay. Then, if you wouldn't mind opening your mouth for me, stick out your tongue and say ah. Okay. And I don't see any swelling of your tonsils or any redness or and your uvula looks midline. Good. Okay. So now I'm just going to take a look at your chest and make sure that the respiratory expansion is symmetrical and make sure that there's no use of accessory muscles for breathing. She doesn't appear to be in any respiratory distress. And I'm gonna come back here and I'd like you to take a deep breath in and out for me. Okay, good. And now I'm just gonna put my hands on your back, and every time I move my hands, I'd like you to say 99 for me.
99. 99. 99. 99.
Good. Okay. And then I'm gonna tap my finger on your back, just listening for any change in sound, any dullness or hyperresonance. Okay, good. I'm gonna listen to your lungs now, so every time you feel my stethoscope move, I'd like you to take a deep breath in and out through your mouth.
Okay.
Now, if you wouldn't mind, I'd like you to say E for me every time you feel my stethoscope move. Okay? E, E, changes in your lung sounds and your breath sounds right there for any maybe crackles, wheezes, or rails. So I did hear a little bit of crackles in the bottom of the right lung, and I also heard a change in sound when you said the letter E in the right lower lung. Okay, so now I'm going to listen to your lungs from the front, and like before, just take a deep breath in and out when I'm Okay, you can breathe normally now. I'm going to listen to your heart. Okay, sounds good. Okay, so I think I've looked at everything, so we can talk about things a little bit now if you'd like. Like I said, I heard some crackles in the bottom right part of your lung, and I also heard a little change in sound. So what that means is there's likely some kind of fluid in your lung over there.
Okay.
Okay? And with your history and that in combination, it sounds to me like you probably have a pneumonia.
Okay.
Okay?
Okay.
It also could be something like chronic bronchitis or COPD getting worse, which could be related to your history of smoking. So, we also want to make sure that it's not tuberculosis, which is a possibility, but I don't think that's very likely.
Okay.
Okay? So what I'd like to do is get a chest x-ray on you today, and we're going to see how that looks, and that'll give us a little more information as to what's going on. And then hopefully we can send you home with some antibiotics if everything looks okay.
Okay.
Okay, how does that sound to you?
That sounds like a good plan.
Okay, I'm going to talk to my supervising physician about all of this information, and then we're going to get back with you with our ultimate plan, and we're going to go from there.
Okay.
Okay, do you have any questions for me?
No questions.
Okay, we'll be back to see you soon.
Thank you.
You're welcome.